All right, class, let me get to chapter 9 here. Share the screen. Slideshow. Start. Chapter 9, we're talking about health insurance. This is exciting stuff, health insurance. You know, we all need it. You never think you're going to need health insurance, but you absolutely do. Let's get into it. Actually, hold on, let's go back here. I don't have any other accompanying videos to this. I had some, but they violated some YouTube copyright infringement. So we're not going to have any additional videos. It's just going to be me talking. So let's talk about some group health insurance. So what is group health insurance? Most of you will get in group and health insurance. You really can't get individual insurance because if you had individual insurance, this is way too much. So whether you like it or not, you get lumped into a group with others. So group health insurance is just health insurance consisting of contracts written between groups, employers, unions, etc., and a healthcare provider. So if you get individual insurance, you basically are lumped in. Like even if you have Covered California, you're lumped in with all those other people from Southern California. Essentially, if you have health insurance with your employer, you're lumped in with all those people. It's the only really way to make it affordable. So that's just basically group health insurance is when you are lumped in with the group, and because it's kind of the power of numbers philosophy. And there's two main types of health insurances which we're going to get into. And so some of the big takeaways from this lecture is going to be right here, the difference between HMO and a PPO. So basically, there's a health maintenance organization, or it's called also known as an HMO. It's an organization of hospitals, physicians, and other healthcare providers who have joined to provide comprehensive healthcare services to its members who pay a monthly fee. Essentially, insurance company tells you where to go. HMO. I'm currently in an HMO, and it's good. It's fine. It's what is this? Not Cigna. Hoag. It's a Hoag HMO, and it's good. I like it. Years ago, if you told somebody, "Hey, I had an HMO," that was kind of like, kiss of death. It's like, oh, that's terrible, HMO. You wanted the other version, which I'm going to talk to you in a second. So basically, HMO, what you need to know about HMO is that you necessarily don't get to choose your healthcare, your doctors. You'll have a choice of people, but basically they say you have to pick these certain doctors. With the other ones just come up, I'm just going to say right now, PPO, you get to choose basically whoever you want. So it's a PPO, preferred provider organization. Essentially, you pick your doctor and or your specialist to provide medical service. So PPO, you have more choices, more flexibility. HMO, it's a little bit more narrow, but HMOs are getting better. HMOs were horrible. You didn't want to have an HMO in the past. Those keep getting better. Blue Cross Blue Shield, that's one of the biggies out there. It's a prepaid hospital medical expense plans under which healthcare services are provided to plan participants by member hospitals and physicians. Basically, anywhere you go in the country, there's going to be a Blue Cross, essentially, or Blue Shield. Pretty much there's going to be an option there. Kaiser, excellent HMO. Hate to say it. 20 years ago, somebody told you, if you had to tell somebody you had Kaiser insurance, they'd probably write you a condolence letter or card, and they felt bad for you. But now it's good. And I used to sell stuff to hospitals, and I'll kind of bring back that experience into this discussion a little bit. But Kaiser kind of is the gold standard for HMOs. A long time ago, you did not want to have Kaiser. Now you do. Why is that? Why is Kaiser work now when it didn't before? Imagine when you go into a hospital, it's not a Kaiser. So in a Kaiser hospital, essentially, everybody who works for Kaiser, and this is not an advertisement for Kaiser, this kind of just lets you kind of explain, I can explain the difference between, a Kaiser HMO type of organization and a non-HMO type of organization. So if you go to a Kaiser hospital, everybody who works there works for Kaiser. That goes from the staff to the physicians to, basically everybody works for Kaiser. All of the people coming into a Kaiser have Kaiser insurance. So, everybody is insured with Kaiser. Everything is streamlined. All of the information is shared, meaning you can go into Kaiser and You can walk into basically any office, any Kaiser, give them your information, and they'll know what's happening with all of your medical history from all the different specialists. When you go into a non-Kaiser hospital, essentially, what you're going to get is you're going to get who knows how many different insurance companies that are going through insurance company. The real power in the medical field in industry has to do with the insurance companies, because insurance companies will approve what gets what gets paid out. So when you go into a non-Kaiser or non-HMO, there's many different insurance companies that come in. It's almost like, imagine you're at the front desk of a business, and HMO is everybody's paying in American dollars, essentially. You get the same thing. And then you're having a different organization, and people are paying in money from all over the country, all over the world. And you have to figure it out. Okay, what is this really worth? What's the translation? Who do I have to call? Who's really going to pay for this kind of thing? So it's more streamlined with Kaiser, and all the information, like I said, all the information is shared. And they're really good at communicating with their customers. When you go into a regular hospital, you can have some physicians and doctors that are working at the hospital. They don't really work for the hospital. They're working privately, just kind of, hang a shingle, as they say, at that hospital. So they're not really an employee of the hospital. And they just kind of use the hospital for their facilities. So that's the big difference. Medicare. What is Medicare? When you get older, get over 65, you'll need Medicare. It's a health insurance plan administered by the federal government to help people over age 65 and others receive their monthly Social Security disability benefits to meet their healthcare costs. You're paying in, if you have a job right now and taxes are taken out, you are paying towards Medicare as we speak. So that's basically what you're going to use when you get over 65. Because when you get over 65, if you wanted to have your own health insurance, you can try it, but it's going to be so expensive, so cost prohibitive. And there's many different layers or levels to Medicare. We'll get into that a little bit too. Medicaid, state-run public assistance program that provides health insurance benefits. Only those are unable to pay for health care. So if you don't have, essentially, and this is what many people have said, I don't know if I necessarily agree with it, but in healthcare, you either want to be rich or be poor, because one of those two, essentially your healthcare is going to be paid for. If you're in the middle, then you're going to have to, a little bit more out of pocket. But Medicaid is essentially for people who don't have the means, and but they still can have their health insurance or health needs taken care of. And there's a different kind of levels and components of Medicare, which is what you get over 65. So once you get over 65, you get your healthcare taken care of through the government, but there are different levels for added protection. Like there's the supplemental. I combined supplemental and medical. The supplemental Medicare Part D is a voluntary program under Medicare, commonly called Part D, that provides payments or services not covered under basic hospital insurance, which is Part A. We can get really, really, really deep into the weeds here, but I don't think it's really overly critical right now. There's Medicare Advantage plans, commonly called Part C. These plans provide Medicare benefits to eligible people who use private providers. This would be like for vision, hearing, dental, wellness programs. And to let you know, mostly that in basic healthcare, for the most part, you don't get, almost always, you don't get dental, you don't get vision taken care of. That's always going to be a little bit more or additional, unless you have those coverages. I'm super lucky that I have good healthcare and I have vision and dental, which is it's not common to have that. And then once you get older, part of Medicare as well is Part D, because one of the big things when you get older, so you're going to have a lot of prescription meds. I'm sure people, your parents or grandparents, who it seems like, they're on so many medications. This just happens when you get older, but that's Part D, covers both brand name and prescription drugs at pharmacies and other distribution opportunities, Participants pay a monthly fee and a yearly deductible, and must also pay part of the cost of the prescriptions. Okay, so you'll pay a much, and we'll get into the cost of prescription drugs here in a second. So with Medicare Part D, you would basically you have to pay your monthly fee, small monthly fee, then you pay a yearly deductible, which is, you pay money as you're paying, it goes towards this, and then you pay a small amount for the actual prescriptions. So here's how much prescription drugs cost. Usually in class, I'll have people guess. How much does it cost to make a new prescription drug? 2.1. This is as of a few years ago. It's probably more now, but $2.1 billion, which is stunning. There's a saying in healthcare that the first pill will cost you $2 billion. The second one will cost you like 25 cents or something like that. But it's all of the R&D, all the research and development that goes into that. So you have to basically put in all of this research and development, do the clinical trials to make sure that it is safe, it's effective, and it's going to do what it says it's going to do. And that generally cost over $2 billion to do it, which is absolutely mind-blowing and stunning. But so what happens, like, let's say I've got my own drug company, legal drug company, and it's going to be Jimco, and I make some pharmaceutical drug. Make a pharmaceutical drug that cures. I don't know what cures. What it's good for. So anyway, you have this, and I spend roughly $2 billion for the research, for the development, for the clinical trials, and all the other kind of procedural things that go along with it. With that patent, I get a patent for 10 years. Okay, meaning that anybody who wants to buy this drug in that first 10 years, it's all going to be name brand, my name brand for that drug, which is, they always have these crazy names for name brand drugs, Celexa. You see the commercials all the time, right? So for those 10 years, that's your time, that's your opportunity to make that money back, right? That's why you do the big advertising. That's why you hit up the doctors. That's why you kind of just do kind of a blitz. So that 10-year period, that's your time to make that $2 billion back. After that 10-year period, then you can then that drug goes to generic. Then other companies can start making that drug on a generic basis. My wife used to work for this company, Allergan. Allergan's known for Botox, and they have this product out right. It's called Latisse, which makes your kind of your eyelashes grow, right? So what happened is they had another really strong area in Allergan was their eye products. They had an eye drop product that they used, and they kept on getting feedback from customers saying that they put the eye drop in, and sometimes when you put an eye drop in, you'll get a little bit of leakage or a little trail of tears out of the corner of your eye. And people kept on complaining that this little trail, they kept on kept on getting growing a little trail of hair out of the corner of their eye from where the eye drops would leak. So they realized, oh wow, I think we're onto something. So it turns out that product, that eye drop product, actually encourages hair growth and actually makes hair growth around your eye, and it's safe for your eye too. So they basically had the exact same product, put it in a different bottle, had a different applicator, but still had to spend the $2 billion in the R&D, even though the product never changed. But they will basically have a 10-year patent on that. After that 10 years, then it can go to generic. So, interesting stuff. Workers' compensation. This is just health insurance required by state and federal governments and paid by employers to compensate for job-related illness and injuries. So basically, if you own a company, you have to have workers' compensation insurance. So in case somebody slips and falls at the workplace, then that person will be, then that will be taken care of as a workers' comp claim. If you don't have workers' comp insurance, as in a business owner, and somebody gets injured at the workplace, you could essentially say goodbye to your business because you can be done. It's going to be very, very, very costly. in the time right now of COVID, it's going to be very interesting to see what happens as more people work from home. There's a lot of interesting discussions going on. It's like, okay, if you're working from home and you trip over your cat, is that a workplace injury? I don't know. If you're working from home and you make some questionable comment to the UPS guy who's dropping off something from or the Amazon Prime person, is that an HR violation? I don't know. So that's kind of this weird area where we're going in right now with everything with working from home and stuff. But back to this, so workers' comp, you need to have a workers' compensation insurance as an employer to basically you pay monthly based on, and your payments or premiums are based on the risk associated with that job. So if you're in construction, the workers' comp is really expensive because you are paying you're basically paying for the risk associated with doing that job. If you have just an office, then it's not that not as expensive. So the more dangerous the job, the job title, the job function, then the more expensive workers' comp can be. That's kind of essentially why some companies want to go make everybody a independent contractor. So technically, you're not an employee. And those workers' comp rates are based on your pay on your payroll numbers. So whatever you do in payroll, whatever goes through your company with payroll, like legit payroll, with person where the company cuts a check with taxes taken out, that's what they go off of it. ACA, Affordable Care Act, also known as Obamacare. Big two goals of Obamacare the ACA was to reduce the number of uninsured citizens in the country. I think it did that. And the second was to reduce the increase in healthcare costs by providing a government-based healthcare exchanges in each state. And for here, it's what covered California is the exchange here in California. And it's actually it has done it. I think both of those they've achieved both those goals. And HSA, this is kind of cool. This is something I want you to know about because think about health insurance. It's kind of boring to talk about it, but an HSA is this is essentially your opportunity, your vehicle, I guess you could say, to make money for yourself on health insurance. It's a tax-free savings account funded by employees, employer, or both to spend on routine medical costs, usually combined with high deductible policies to pay for catastrophic care. So basically, you can get an HSA. You can do some more research on that. And essentially, an HSA is a side account you have on the side that you basically pay into, and you can pay into it every year. And you can use as much or as little of that healthcare as you want. And every year as you pay into it, you're basically building up a bank, a side investment in yourself. Who should use HSAs? Usually people who go to the doctor a lot, or people who don't go to the doctor at all. Because if you go to the doctor a lot, you're going to basically you're going to burn through that HSA, which is fine. If you don't go to the doctor a lot, then you'll barely use any of it, and you'll have this kind of just like this almost like another like IRA, like individual retirement account, based on the HSA. HRA, health reimbursement account. It's an account in which employers place contributions that employees can use to pay for medical expenses, usually combined with a high deductible health insurance policy. Major medical plan. An insurance plan designed to supplement the basic cost of hospitalization, and this should be in all of your health insurance plans. Hospitalization, surgical, and physical expense, physician's expenses used to finance more catastrophic medical costs. I put it in here. It says how hospitals get paid by contracts, 30-day rule. When I was selling stuff to hospitals, I remember I made this big deal with this one company. I won't say the hospital. And there was a better or bigger hospital nearby that they were the insurance companies basically didn't pull, but they changed. It was for a heart procedure. So if you had insurance with a certain insurance company and you had to get a heart procedure, you would contact your insurance company and say, here's what we need to get. You go to your doctor. Doctor says you need to get this done. They're going to recommend the insurance company two different hospitals, or a hospital. There was a big hospital, it was a flashy hospital, good hospital, but they had a lot of cases of people dying, So instead, they recommended this smaller hospital that I was working with. so they basically kind of got the smaller hospital essentially got the contracts for a certain type of procedure, and that's what the insurance companies would recommend or route these people where to go. Um, and sometimes, like if you see the 30 day rule, what happens sometimes in hospitals in healthcare is if you ever know somebody who's in the hospital, like, okay, I'm ready to go. I just want to go and get out there, and they keep you, maybe a little bit longer than you should, and they keep doing more tests and all that kind of stuff. The reason is if you return back to that hospital within 30 days of the time you released for the same, and you have to come back and be readmitted for the same thing you were in before, then that hospital will not get paid by the insurance company. So sometimes that's why the hospitals are a little apprehensive about letting people go, and they show a little bit more restraint. Comprehensive medical, major medical, it's a health insurance plan, just like it's very actually similar to this one here. Health insurance plan that combines into a single policy the coverage for basic hospitalization, surgical, and physical expenses, along with major medical protection. Really not that much different than the previous slide. Deductible. What types of deductible? That's just the initial amount not covered by an insurance policy, and thus the insured's responsibility, usually determined on a calendar year basis or on a per illness or per accident basis. So like in auto insurance, essentially, let's say you have a deductible and your deductible is a $500 deductible and the damage to your car is $5,000. Okay. You as the insured, you only have to pay the $500. You don't have to pay the 5,000. Similar type situation in health insurance. You pay up to a certain amount. After you paid up to that certain amount, the health insurance provider takes care of everything over that. They will have kind of out-of-pocket limits, and that's kind of baked into your deductible as well. Internal limits, just a feature commonly found in health insurance policies that limits the amounts that will be paid for certain specified expenses, even if the claim does not exceed overall policy limits. So within every policy, you're going to really kind of have to look and see what the internal limits are. But you just need to make sure that you talk to your whoever the agent is or whoever the person is actually selling you the insurance, so that they know, and have them walk you through all these all the issues with and all things you need to know about that policy. Pre-existing condition clause. This is a big thing for the ACA. Obamacare. It's a clause that most health insurance policies permitted exclusions of coverage for any physical or mental problems the insured had at the time the policy was purchased. So what was happening was that you'd have people, I knew a girl, she had lupus, and that lupus is, not a fun thing to have. And it was really difficult for her to get insurance because essentially insurance companies, they want to mitigate their payouts. And if you are a high risk person, a lot of times they don't want to have you as an insured because they know they're going to have to pay a lot on you. Yes, you're paying them your monthly payment, but if it was up to them, they wouldn't want to pay anything out. That's not actually true, but well, kind of. So I knew this girl I used to work with. She had lupus. It was so hard for her to get insurance, so she had to go on Medicaid. Now we get the ACA, and she's had insurance, no problem. So basically, insurance companies prior to that could say, no, we don't want to, and we don't want to insure you because you have this kind of very costly medical condition. And you think to yourself, isn't that the purpose of point of having health insurance? You don't have to, so that somebody else can take care of that. Well, they don't have to always take care of that for you. So now with the ACA, companies, health insurance companies cannot exclude somebody because of a pre-existing condition. COBRA, you don't see this as much anymore, but it's a Consolidated Omnibus Budget Reconciliation Act. It's a federal law that allows an employee to keep their insurance if they lose their job. So let's say you have a job, you got this really great health insurance. It's health insurance that you absolutely love, right? And then you say, you know what? Then you lose your job. You might not have health insurance. You're kind of out of that little period for enrollment into a Cover California. What do you do? But you want to make sure that you're still covered. You can have, it's called COBRA, take care of that. Only problem with COBRA is it's really, really expensive. So let's say you have a great health insurance with your company and you're paying like $200 a month, and you say, okay, you can still have the same insurance through Cobra, but that will be probably, I don't know, $800 a month or something, and then it just goes up from there because people really don't want you to have health insurance through Cobra, but the option is there, especially if you have certain treatment that is already, if you're in the middle of multiple rounds of a certain type of treatment, you don't want that to be interrupted. Like let's say you broke your leg and you have all of these rehab appointments set up through that provider. Let's say, okay, for example, you broke your leg on January 1st. Okay. You get fired or you lose your job on February 1st. So you want to have a streamlined health coverage. You're going to have the cast on for 6 weeks, and then they're going to put you in a walking boot for 3 weeks, and then you have PT or physical therapy for 8 weeks following that. If you just lost your health insurance, then basically you kind of have to start over and you have to figure out what you're going to do. If you go with like a Cobra type of company, Cobra option, then you can keep that same insurance and make that kind of seamless for that entire time. It's going to cost you more money, but at least it's kind of, you have to weigh the pros and cons. Long-term care, just the delivery of medical and personal care other than hospital care to persons with chronic medical conditions resulting from either illness or frailty. It's just, just long-term care. It means essentially you're going to be taken care of for a long time, possibly in the hospital. Waiting period, elimination period. This is interesting. Most people think, here's what you cannot do. You cannot say, oh my gosh, I really need to get, I know I'm not in good health. Or for example, let's say I'll use this as a situation for dental, right? Oh my gosh, I need a ton of cavities. I need a ton of dental. I need a lot of dental work done. But I don't have health insurance. I don't want to pay for it myself. So I'm just going to go get health insurance. Then once I get the health insurance, I'm going to get all this dental work taken care of. It doesn't work that way. They will have a waiting period, meaning that you can get your insurance. You can get small things done, like your cleanings and x-rays, but any major work, you have to wait 6 months or a year because they don't want people to do exactly what you tried to strategize to do. Is that because they want to make sure that you're paying into the system, you're paying into you're paying in with premiums. They're not losing money right off the bat with you. So, but the definition or the description is the period after an insured meets the policy's eligibility requirements, means that you get approved, during which he or she must pay expenses out of pocket. When the waiting period expires, the insured begins to receive benefits, like the full benefits. Disability, income insurance, insurance that provides families with weekly or monthly payments to replace income when the insured is unable to work because of a covered illness, injury, or disease. You pay into that with your if you have a job now, you're getting taxes taken out, you're paying into disability. And they used to do it every year, every 2 years. Social Security Administration would send you an update of here's how much you have in Social Security benefits. If you retired now, here's how much you would get. If you retired at the age of whatever. Actually, no, if you didn't retire now, if you retired at age 65 or 67, here's how much you get. If you were injured and disabled on the workplace, now here's how much you would get. I think the most max you can get is $60,000 as of a few years ago annually, because of if you became disabled in something work related. Maybe not even work related. I had a buddy who was getting 60 grand at one time. That's it. All right. That's chapter 9. And that's it. I'll put chapter 10 up here in a second.